Poverty more than a norm. What is poverty and how is it determined? Poverty is defined as the rate of being extremely poor, or the inability to make ends meet by whatever means. Since the earlier part of the 1960s, the status of poverty has been determined in a unique way. Thresholds are determined by comparing the cash income of the household, which are the wages and salaries before tax, to a threshold that also accounts for inflation based on the Consumer Price Index. The poverty rate for children is for that portion below that threshold. A family can be considered poor if their income is below that determined poverty threshold, and it is adjusted based on the size of the family, the ages of the members of the family, and the composition of the members of the family. However, the income determined for the poverty threshold does not also take into effect benefits such as Medicaid, public housing, health insurance provided by your employer, and food stamps. Who is affected by poverty? Based on every source studied, the general consensus is that there is an estimated around 40 million people in the United States who fall along the poverty line. According to the National Center for Children in Poverty and the Children's Defense Fund, ethnic minority groups such as Hispanic, American Indian, or Black children are among the majority of the estimated over 15 million children in the United States that fall below the poverty line. An additional interesting fact is that the children of immigrant parents are at a higher risk of being below the poverty line. The statistic that there are over 15 million children in the United States make them the largest age group of poor people in the nation. 25% of these 15 million are under the age of 3. This is larger than other industrialized nations, which have more effective ways to deal with poverty compared to the United States. Where in the world does poverty occur and how does it differ from the U.S.? Poverty in China has always been an important problem to have to be solved for the development of China as a social and economic power. A report released in 2016 by the National Bureau of Statistics reviewed that the number of people that were affected by poverty in rural areas was calculated at 43.6 million, according to the standard that every person has to survive on 2,300 yuan a year. A process that they have started in China is a practice called educational poverty alleviation, which is a way that they alleviate poverty by allowing educational services to areas that are stricken by poverty so that the people affected by such can gain the knowledge and skills to get rid of poverty. This practice has been successful, and it was reported in December of 2015 that 6 different new programs in China were adopted into rural areas to increase wisdom first, then to prevent them from returning to the state as they were before. How much of an issue is it really? Children that are below the poverty line are at a greater risk for physical or mental health than those at wealthier levels. One such medical issue that is a more noticeable one in recent studies in the United States is the obesity rate. Obesity is a major risk factor as it is a chronic disease that can decrease quality of life and the economic productivity of those involved. Recent evidence and research has revealed that factors such as where we live, the people we associate with, and the places we work and things we learn also affect our health because they literally form our behaviors and how we act, and they affect us on an individual level. An example brought up in Source 7, for example, is being poor and living in an area where there is a high concentration of poor people may have a different effect to someone than living in a place with a higher concentration of wealthier homes. It is quite fascinating, in fact, to think that our behavior is shaped merely by the concentration of buildings around us. It can also be predictable, however, in the case if the neighborhood is that of a higher concentration of obesity because of poor households and no good access to fresh, healthy foods and good, safe places to exercise. Being poor in a better neighborhood would at least provide you with more places to safely exercise. However, there is also the psychological idea that you are inferior to everyone else in the area, especially if one were a member of a racial minority from those in the rest of the neighborhood. This could also cause a higher amount of obesity as well. Obesity is not the only risk that children face in childhood poverty. According to a recent journal released by the American Sociological Association, poverty for children is a stressful idea with early and repeated exposure to stress, and it has been known to lead to environmental hazards. Investigations have seen that children that live in poverty are exposed to more family turmoil, separation, instability, and violence than those that live in wealthier households. They also receive less emotional support from family members. does not end there. Children living in poverty are seen to experience less cognitive stimulation at a younger age compared to that of wealthier children. It is not to say that the parents are not educated, they just merely do not have the means to provide their child with the stimulation that wealthier children get statistically, such as reading aloud to their child or visiting the library compared to middle-income families. This income gap also affects their play space, making it smaller and not having appropriate toys for their growth. Developmental cognitive neuroscience research in humans is actually very interesting. They examine the white and gray matter in the brain to examine exactly what is going on as it develops. Specifically, white and gray matter are very vulnerable to environmental perturbations, or changes in the environment which change the actual structure of the brain. The frontal lobe has been examined in this science and found that it primarily handles behaviors such as planning, attention and impulse control, and investigation. It also is part of the brain where postnatal development is especially vulnerable to early life experience and stress. Exposure to poverty during this period has seen in research to actually change the structure of the frontal lobe of infants as they are growing during this period, and it can have negative effects even into adulthood. The effects on the brain are unfortunately permanent and can affect the working memory of the child as they grow, and cause many other mental and physical problems as they grow and experience life. So how long has been an issue for, and how has it changed? Income inequality has grown out of control over the course of the last 40 years, after there have been decades of decline. Now, however, we are at levels similar to those during the Great Depression. In the later part of the 1950s, the rate for poverty of Americans was at 22.4%, or 39.5 million people. This has declined in the 1960s to a surprising 11.1%, or 22.9 million people in the year 1973. And this goes on at crazy rates of decline and decrease. But then in 2010, it actually went all the way back up to 15.1%, or 39.3 million people being affected by poverty. So, what can be done? There have been multiple attempts in the social work world to establish training programs in the United States for social workers to address the issues of childhood poverty with their clients. The need to have an understanding, to have an action plan, to take on poverty in the United States is a great social work concept, and it is a good ethical requirement of the social justice and social caring. Another method of trying to alleviate the issue of poverty in the United States is to implement specific policies in states for college students, like scholarships and grants that allow for things like student loan or tuition waivers. Chongqing, China, has designed this in a number of ways with unique projects so that students who live in poverty areas and families who live in poverty areas have more opportunities to go to college and complete their studies with money forgiveness and will not go back into poverty. Also, improving the conditions of already running schools in areas that are poverty-stricken and adopting the concept that everyone studies in good schools is a healthy concept that Chongqing, China has adopted. One of the best adopted strategies for helping the poverty could potentially be teaching those who do not have it as worse off about poverty by taking them into areas where poverty exists. Engaging the students firsthand in the community allows them to literally be in an area that becomes the classroom. They are able to learn firsthand with experience and gain their own understanding by interact with those who are less fortunate. Thank you for watching.